Colon cancer is a type of cancer that begins in the colon, which is the largest part of the large intestine. It usually begins as small non-cancerous clumps of cells called polyps inside the colon. Over time, these polyps can convert into colon cancers. It usually affects older people, but it can happen at any stage. According to one study, colorectal cancer is the third most common type of cancer in the United States. Around 1 million cases of colon cancer were reported in 2021 alone. Plenty of early signs and symptoms may indicate something wrong with your colon. In this video, we will talk about the 8 most common symptoms of colorectal cancer. Make sure to watch until the end, because there is one sign that people usually ignore. Number 1. Blood in stool. One of the most common symptoms of colon cancer is bleeding during a bowel movement. If the blood is fresh and bright red, it is due to piles. Piles can cause swollen veins in the back passage. These veins are weak and can be damaged by the poo passing through the rectum, causing a little bleed. However, if the bleeding occurs from higher up in the bowel, blood will be black or dark and can make your stool look like tar. This type of bleeding can be a sign of colon cancer. Number 2. Stools that are narrower than usual. When the colon cancer progresses to an advanced stage, the tumor can spread to nearby lymph nodes, and changes in stool and bowel habits become more common. The narrowing of stools, especially pencil-thin, indicates that the tumor is growing deeper into the layer of intestinal tissue. A tumor causes bowel obstruction, either partial or complete. Narrow stools that occur infrequently should not be concerning. However, if this condition persists for more than a week, seek medical attention from your doctor. Number 3. Anemia or low hemoglobin count. In colon cancer, tumors release certain chemicals that stimulate the formation of new blood vessels. These vessels burst as the tumor grows in size and lead to the loss of red blood cells. As a result of bleeding, iron deficiency anemia occurs. Even if there is adequate supply of iron in the blood, the surrounding inflammation can trap iron molecules in the immune cell. As the inflammation persists, the availability of iron becomes reduced, resulting in the development of anemia. Number 4. Constipation. To understand constipation, you have to understand how the large intestine works. The large bowel draws water and nutrients from the food you eat, and stool is formed. When muscle in your colon is weak, there is a slow movement of the stool. As a result, more absorption of water occurs. In colorectal cancer, the tumor in the bowel lining can affect the nerve supply of the muscles and causes constipation. Number 5. Cramps and bloating. Cramps and bloating are common digestive system issues caused by certain foods, stomach upset, and gas. An average person produces about 1 to 4 pints of gas daily and passes gas up to 21 times a day. However, if the tumor's obstruction in the colon hinders your ability to pass gas, it can cause bloating and cramps. Number 6. Unexplained weight loss. Several factors can contribute to cancer-related weight loss. Cancer cells require more energy than normal cells, making your body burn more calories than usual, even at rest. Cytokine production also increases as your immune system tries to defend your body against cancer. Cytokines increase inflammation, alter metabolism, and interfere with the hormones that control appetite, causing further weight loss. Number 7. Fatigue. People with colon cancer feel weakness and constant fatigue. Although feeling tired after hard work or lack of sleep is normal. However, chronic fatigue does not go away in cancer patients even after proper sleep. You may feel mentally, physically, and emotionally exhausted most of the time. This is possibly due to cancer cells using extra energy and the stress of bowel symptoms. Number 8. Feeling as though the bowel is not empty. If a tumor grows into a blockage in the colon, it gives the feeling that the bowel is not empty. People feel the need to use the restroom even if their bowel is empty. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Do you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell notification button.